This one I do apologize. I don't really have a photo associated with this very first slide to help be identifiable. But it is nonetheless a really important subject. The bone, again, you will remember, has a very mineral dense structure. In fact, it's storing 99% of your body's calcium, which is extremely important for a lot of your system's functions. Your heart needs it to beat, your brain needs it to think, your muscles need it to move. A lot of the things within the cells need calcium in order to make it work. If it doesn't, then you're in deep, deep trouble. So there are two different groups really fighting for that calcium, and their main goal is either to put calcium in the blood or put calcium in the bones. Parathyroid hormone's in the camp of putting calcium in the blood. It makes sense that you're going to want that calcium, that level, because you want to be alive rather than having your bone alive and well, and maybe your bones being a little rickety compared to being dead, but your bones being fancy. Unless you're planning to be a fossil. But then even then, that calcium's gone. Parathyroid hormone comes from glands on the back of your thyroid. If you want to find your thyroid, you just find your Adam's apple, you go down or you descend inferiorly, and you will find the thyroid just below that Adam's apple. And on the back side, or the posterior portion of that thyroid, is the parathyroid, which secretes this parathyroid hormone. It's going to pull calcium from two different places, your bone and your urine. Bone, well, it makes sense. You're storing 99% of calcium there. And urine, well, we don't really want to lose any more calcium, so we might as well try and pull out as much as we can from urine. Vitamin D, which is another fancy word, there's a really fancy word for it called calcitriol, absorbs calcium from your guts. This is really, really important for you if you want to maintain your bone density, if you want to maintain while still maintaining your body's systems. Because if you're pulling from your guts, then there's less that you have to pull from your bones. So just a reminder that vitamin D is necessary. You have to, in order to activate vitamin D, you have to go outside and let the sun hit your skin and activate that vitamin D. Without that vitamin D, there's a lot of uh-ohs. And we'll be talking about that in a little while. The things that are fighting for calcium in bones is one, calcitonin, which stops or inhibits a lot of the osteoclasts. You got growth hormone, kind of makes sense. Growth hormone's there to help promote bone growth. So yeah, you're probably that growth hormone better be instigating the reabsorption of that calcium from blood. When you're finally adolescent and adult, you're going to have, depending on your gender, testosterone and estrogen, inducing bone growth and maintaining it nice and strong. You're also going to need to be taking in vitamin C, which is helping promote that collagen matrix, which you need for your deposit that bone, that calcium onto. So again, this is a Butemus negative feedback loop. You have low calcium levels, so what's going to happen? The receptors on the parathyroid gland are going to notice that you've got some issues, instigate the formation of parathyroid hormone, which targets osteoclasts and kidneys. Osteoclasts are the ones that break down bone. You break down that bone, you release that calcium out into the blood, you reabsorb that calcium from the kidneys, you increase it, and once you're back to normal, hallelujah, we're going to stop making more parathyroid hormone. So let's look at all things that affect bone growth. We got calcium and phosphorus, that one makes sense. Magnesium, that one we haven't talked about, but it helps in the bone matrix. Fluoride, you've been told that the fluoride toothpastes are good for your teeth, and that's true. It helps out with the strengthening that extracellular matrix. And then manganese, I love saying that, manganese, activates enzymes that help in creating the extracellular bone matrix. Vitamin A we didn't really discuss much, but does help out with osteoblast remodeling. So if you want your bones to remodel quickly after a bone break, you're going to want that vitamin A. Vitamin C, if you're lacking vitamin C, to help you really get that point home about vitamin C, pirates, sailors, all those people that couldn't, back in the 1500s, 1600s, that are crossing the seas, often developed scurvy because they didn't have any sources of vitamin C often. And when they do that, it's characteristic of their skin being weaker and easily ripped, their teeth falling out, their bones being weaker, because again, you can't really form that collagen matrix that strengthens those joints and provides that network, or that the osteoblasts and osteoclasts use to solidify. Vitamin D, again, it's that signal that helps reboost your calcium back into your blood, but by pulling calcium out of your guts. Vitamin K and B12 are the synthesis of bone proteins and helping avoid abnormal protein production. We talked about a lot of these hormones already, except for thyroid hormone and insulin-like growth hormone, both of which have some type of metabolic properties / growth properties. Insulin also induces normal bone growth. Exercise does it. Aging does the reverse. But I do want to point out one thing about the hormones that actually segues into the disorders. We're going to be talking about the osteoporosis. Osteoporosis, depending on whether you have genetic abnormalities or anything, is just exactly what it sounds like. It's osteo, so bone, porotic, or porosis is the porous. You have formed bone pores. There are pores in your bone. Here's normal, here's osteoporosis. You could have a genetic predisposition for it, meaning that you can thank your mom and dad or grandparents, or you're female. Most people with osteoporosis are female. Reason why is once a woman hits menopause, they're no longer making estrogen. And if you remember, estrogen has a huge role, absolutely ginormous role, in making certain that your bones stay nice and strong. Males' testosterone keep on going strong, while females eventually peter out in menopause and may need to take supplemental estrogen. Now let's talk about a lack of vitamin D, or a lack of a response to vitamin D. The lack of response to vitamin D being a genetic issue, while the lack of vitamin D is more of a dietary issue. If you're growing up and you're not getting the vitamin D that you need, then you're going to get this really characteristic bow legs. Now this is different and distinct from children that walk early that get the little bit of a bow leg. Usually they recorrect by 6 or 7, but rickets, if you got some genetic predisposition for not responding to vitamin D, or you're not getting enough vitamin D in your diet, you're going to get this bowing going on. Because remember that vitamin D helps reabsorb calcium into your blood, and then eventually helps give you that supply of calcium to build up that calcium network and the calcium phosphorus network in your bones. So all you're really left with is that collagen network and that hyaline network that is easily bent out in bows like this. Now what happens if you have that genetic predisposition and you're not doing your vitamin D appropriately, you're a night shift worker? Then you get osteomalacia. Osteomalacia, this is a normal spinal picture from the case.edu. And this is osteomalacia provided by Dr. Ella Nazir. You'll notice that this is the vertebrae in the back of two different individuals. A normal individual taking their vitamin D, no genetic predispositions for that, no bad history of osteoporotic bones or anything. Nice and flat on the bodies of this vertebrae. But look at this osteomalacia that's indented in. It's kind of like almost a scoop-like appearance here. As well as the lower portion of that vertebrae is also indented in. Drink your milk, get outside, at least for 15-20 minutes, and you'll be doing a-okay. With that, that is the end of our lecture on the skeletal system. Next ones we'll be focusing on identifying bones, bone markings, and the lot of those.